surgeon. I originate from the state of Georgia and have been practicing in Knoxville, Tennessee for the past 5 years. The reason we're here today is to talk about Boomerang and Tiger Shark C. Very versatile implant. As most spine surgeons have used in their time, ACF plates, usually a classic 4-hole plate with anywhere from a PEEK to titanium to 3D printed titanium spacer. So there's a lot of solutions on the market, but I'm a firm believer that Boomerang and Tiger Shark C are the best ones for anterior cervical fusions. One of the first patients I want to talk about is a 55-year-old male who had a previous C5 to C7 ACDF with a classic allograft interbody cage and 6-hole plate and screw construct. He developed an adjacent level disc herniation, left-sided trapezial and shoulder pain from foraminal stenosis at C3-4 and C4-5. Looking at his preoperative imaging, one can see that the plate is actually quite close to the adjacent level end plate, which can make putting adjacent level hardware in without requiring removal of the previous hardware, which when going from a 2-level to a 4-level can increase exposure time, operative time, as well as difficulty given removal of the hardware. After conservative management, the patient failed an elective for operative intervention. And this is one of the big uses of Boomerang, and the fact that we did not have to take out any of the previous hardware given the design of the plate. Did a classic anterior approach to the spine with disc and end plate preparation, as well as decompression of the central canal and the neuroforamen with placement of the Tiger Shark C and Boomerang plate and screw fixation. The only hardware that we ended up removing was one of the screws in the plate at the C5 level to put a cast or pin in for extraction. Other than that, no hardware had to be removed or even burred to make room for the plate. As you see from the post-operative films, the patient has good maintenance of disc height with no subsidence of the cage, as well as appropriate placement of the plate and screws. About a year out from surgery, the patient is doing well with a solid fusion. The next patient is a 38-year-old female who classically I would like to do a disc replacement on, but looking at her preoperative imaging, had pretty significant disc collapse at the C5-6 level. She presented with a classic right C6 radiculopathy radiating into the radial hand. She tried numerous non-operative modalities, including physical therapy and injections without improvement, so she'd like to for operative intervention. As with the previous patient, we elected to use Boomerang and Tiger Shark C. Now, this patient with no previous hardware and no previous surgery, use of any type of implant would be appropriate, but given her young age and the risk of adjacent level disease, using the Boomerang plate allows for minimal footprint of the hardware, so if adjacent level need to be completed, you shouldn't have to worry about removing the previous hardware. About 3 months out from surgery, the patient is doing well with the resolution of her radicular symptoms. The final patient is a 63-year-old male with bilateral arm pain from the shoulders all the way down to the hand. With his preoperative imaging, he has fairly significant degenerative changes beginning at C4-5 down to C6-7. After failure of conservative management and worsening pain and weakness in the hands, he elected for operative intervention. Standard approach was done with a 3-level ACDF, and this is another big benefit of Boomerang. Using the Boomerang plate and Tiger Shark C cage, you're able to do individual fusion levels without having to place a large plate at the end of the procedure. You can complete each level individually, and once you finish it, you can move on without having to look back. Furthermore, you don't have to worry about putting a large plate anteriorly, which post-operatively can be off-kilter, oblique, which I'm sure many of you have noticed. Patients will always question that. With the post-operative film seen here, there is no concerns if the plate is off-center or not aligned correctly, as each plate is individual. Now, I know some of my partners and friends have asked questions about the technology with just doing 2 holes versus a 4-hole plate, or added holes for how many levels, but the plate is as structurally sound as a 4-hole plate. After using this implant for the past 3 years, I've had no issues with non-unions, hardware failure, or even any significant subsidence with the cage.